So I'm delighted to introduce Karen von Berg. I think many people know Karen is one of the only person actually that works both in the pediatric and adult clinics. So she has a unique perspective on care in both of those places. So thank you so much.
Thank you. All right. Thank you all for coming out today and joining us. And thank you also to those who are joining online. As Dr. Mogazel shared, I want to spend the next 30 minutes talking about how you can advocate better for yourselves to partner with us, your care team. In addition to being a physical therapist with the care team, I am a PEP or Partnership Enhancement Program facilitator with the CF Foundation, hence me being here to do this talk today. So a quick overview of what we're going to cover in the next 30 minutes. I'm going to take you through how the PEP program came to be, give an overview of PEP skills as taught to clinicians. This program was really developed to teach clinicians how to have better conversations with people with CF and their families. And then I'm going to flip the script and talk about those three main skill sets we teach to clinicians and kind of put it into perspective for how people with CF and their families can use those same skills or similarly use them to create better relationships with their care team. So the road to PEP. The CF Foundation conducted research and learned that people with CF, their families and care teams cited a need for better conversations, specifically things around physical, mental, and emotional health, social and economic challenges, preparation for transition to adulthood, which is a big one, and also sustaining daily CF treatments. And that is how this program came to be. And I love this image on the right. You can read it there. The font is too tiny for me to quote it, for me to see on the slide in front of me. But basically the guy on the right talking with the red can may be saying a lot, talking for a long time, or maybe he's using words that the person on the left, I said my left and right wrong, right? The red can's on the left. Anyway, maybe saying too much, words are too big, that the person on the right doesn't understand. Or maybe that person on the right just has a lot of other things on their mind and that message isn't getting through. So what we're aiming to accomplish with PEP skills is that the communication flows both ways. We don't want to just download a lot of information on you. We want to talk, but we also want to hear from you. We want to make sure those lines of communication are open, going both ways. So the PEP program, again, it's a course in relationship-centered communication. Once the foundation learned there was a need for this, they partnered with the Academy of Communication in Healthcare, or ACH, which is an organization that's been around for close to 50 years, I think. And they have been teaching this relationship-centered communication class originally just developed by physicians for physicians, and then other disciplines were pulled in. The CF Foundation trained myself and about 24 other CF clinicians from across the country. And you may notice somebody else in there if you're in the adult world. Our pharmacist, Jonathan, is also a PEP facilitator, and we also have pediatric and adult physicians who are facilitators, a physician's assistant, nurse practitioners, social workers, respiratory therapists, dietitians, and a couple of parents of people with CF who are trained facilitators. We run full-day workshops at CF centers across the country, or we offer them virtually over the course of 2 weeks. And there's a lot of evidence to support using these skills. Most of the evidence is in the primary care world or with surgeons. We don't have a lot of research in CF specifically, but what the evidence shows is people who use relationship-centered communication skills have patients that have better health outcomes. And this has been seen in terms of pain management, high blood pressure, diabetes. There's improved healthcare professional satisfaction, so less job burnout, higher job satisfaction amongst clinicians who use these skills, and overall improved patient satisfaction scores. So when people go to see clinicians who use these skills, they're more likely to recommend these providers to their friends and family members. A lot of evidence to support using them. So PEP gives us tangible skills that we can use to really provide a respect and openness to different opinions and different perspectives. On the slide here is what we as the care team may see in a daily treatment plan. You have to do these different medications or treatments this many times a day. Well, someone with CF shared their view with their care team of what their daily treatments looked like. And it looked like this, where everything highlighted in yellow is related to CF. And it's quite tiny there, so I don't know if you can see it, but basically this person is getting up at 6 a.m. to start their treatments and not going to bed until, I think, midnight, go to bed. So you can imagine if we were to change or add a certain treatment, how this may be disruptive to this person's day, right? So we as a care team need to be open to learning more about your perspective on things and how you're living with CF day to day. We need to have those lines of communication open to understand how a slight change may disrupt your world. And this is another look at perspectives. If we look at the center one, the yellow dot, you may see me or know me as one of the physical therapists on the team. When you come to clinic, that may be all you see. You think of me as the CFPT and not all those other colored dots on the left side of the screen, that I'm a wife. I'm a mom of 3 teenage girls, and that right there is enough to fill in all those other colored dots and many more. I'm a coach who has practice happening right now, and I'm worried, did my husband get my daughter there on time with the equipment so that the assistant coaches can run the practice? I'm thinking about what I need to get shopping on the way home from here. There's a lot more than just that one yellow dot. The same goes for you guys. That yellow dot is CF. And you're so much more than just that CF. There's your past history, there's your values, there's what happened on the drive into clinic. There's so much more than that. And when we use these relationship-centered communication skills, we open ourselves up to learning more about that and understanding more about you as a person, not just putting all those yellow dots of CF in there in our eyes of what you are. Okay, so these are the 3 main skill sets of PEP. Establishing trust. We teach clinicians to really include and address what's most important to people with CF and their families. Then we want to create open dialogue to truly gain a greater understanding about their perspective, their ideas, their values, their preferences, their emotions. And the third skill set we teach is about setting goals by partnering, engaging in stronger collaboration to share information and create and confirm the next steps. Essentially, I see this as the 4 C's. First of all, care and concern for what's important in your life, CF and all those other colored dots. Curiosity, getting your story, respecting you as an expert in your care or your child's care. And collaboration in sharing knowledge and education and planning the next steps together. So what if we flip the script on these skill sets? Let's see what it looks like from your point of view. So we teach how we can partner better with you, and now we're really going to get into how you can partner better with us. Tell us what matters. Prepare a list before you come to clinic of questions and concerns that you have and that you want to share with the care team. And then dive into it. Share your perspectives, your ideas, your values. Name any emotions or feelings that may be associated with managing CF. We want to know about you as a person, not just the one yellow dot. And then ensure understanding and agreement on next steps before you leave, before you hang up the phone, before that doctor walks out of the hospital room. Make sure you have an understanding. I know for me, even taking my kid to the pediatrician, they have an ear infection, and the doctor says, okay, you're going to go and pick up this medication and they're going to take it this many times a day. And even by the time I walk out of that office and get to the pharmacy, I've forgotten, was it 1 or 2 times a day? You know, so just make sure you have what you need and you understand what those next steps are. So one way that we are helping you to do this, you may have seen this on the pediatric side. We've created a paper agenda and given you the space to write down what your concerns are, what care team members you want to see today. So even if you haven't prepared your list in advance of coming to clinic, usually Donna is the person walking in the room on the pediatric side and asking you what's on your list. Then each discipline, each, PT, pharmacy, social work, whoever else goes in, hopefully we're asking as well. When I go in, I say, what physical therapy related concerns do you have today? And I want to make sure I share what's on my agenda also. I wanted to do an annual visit. What else is on your list before we get to that annual? So we want to make sure we know what's on your list, you know what's on our list, and then we can negotiate the plan for the visit together. And I saw time come up a lot on what you don't like about clinic. This can really help to streamline your visit and make sure that your needs are met and we're getting to the priorities that you have for that visit. On the adult side, it looks a little bit differently. We send out an electronic survey in advance of your appointment. So I know you guys get a ton of my chart messages, especially leading up to appointments. But this is your opportunity to think about, what do I want to address when I come to clinic? And then the second part of it is, what providers do I want to see today? And again, that gives the team, we review this in our pre-clinic meeting before we head over to the clinic building. We have an idea of what's going to happen. The nurses will still go in and ask what's on your list, as will all the other providers. But this really helps to set the stage and again, can help to streamline the time that you're there in clinic. What other potential, and Holly or Amanda, I don't know if you can get a mic from back there. Oh, you good to go. Go team. Your chance to share. What are the potential benefits of setting your agenda prior to coming to clinic? Oh, yes. And people online, you can put it in the chat. We are monitoring that as well. So we invite you to share. I forgot to mention, this is an audience participation kind of thing. We want to hear from you. It's a two-way street. Any thoughts? You forget something. It can get confusing when you get there, right? Maybe PFTs weren't what you thought they would be, and then everything else goes out of your head, or maybe your kids are acting crazy and you forget. Yeah.
Okay. So for example, this week my husband went in and I typically bring my kiddo in. And so I sent him this list and he got so annoyed with me because it was like, and then don't forget to do this and don't forget to say that. So like, had I sent it in my chart ahead of time, possibly it would have gone better for our relationship. And
So yes, that I can see how that can, a relationship can be challenging if that person isn't the one going to clinic, but that's important, right? He wouldn't have known the things to ask anyway. Any other thoughts on potential benefits?
I know as a clinician, it's also nice to get a little peek into what somebody wants to talk about ahead of time. So if I need to get any resources or handouts or do any sort of like research or literature search, I can do that ahead of time and be prepared when I go in the room rather than telling the patient or the person or the family that I'll get back to you afterwards. So it's nice to be able to do that research ahead of time.
Yeah, thanks, Lauren. For those who don't know Lauren, she's one of our PTs on the adult side. So us knowing in advance, if you're giving us that information before the clinic, or even when you come to clinic and say, I've been having this issue with my vest, I need to see the PT today. Maybe we weren't planning to see you because you weren't due for anything in our mind, but now we know we need to go in and see you. So it helps the team to plan as well. Or maybe you have something on your list and, yesterday we didn't have our social worker in clinic because she was up in Maine learning more about CF. But then if you have a question about social work, we know that she can follow up with you afterwards. Becca can give you a call after clinic or when she returns to town. And that way you don't just not ask the question because she doesn't walk into the room. All right, we're going to move on just in the interest of time. On the table, there should be a handout that gives you some additional prompts for things to think about before you come to clinic. I'm not going to read through all of them here, but this is just to kind of get the gears turning and think about things that you may want to bring up during your clinic visit. Moving on to the second main skill set, it's all about you sharing your story, getting your thoughts, your perspectives, your feelings out on the table. So that's why the image is there of the table with the different books. I like to think about this as you getting all the different chapters of your story told during the clinic visit. The symptom story is kind of obvious. We're going to ask questions about it. You're going to tell us about it. That conversation is usually already happening. But what about the personal story? Sometimes it comes up, sometimes it doesn't. But knowing how these things impact your day-to-day activities is really important and is going to help us give the best care back to you. Also, the emotional story. How does it make you feel? And I know when I learned this, the emotional story, I'm a physical therapist, not a mental health therapist. I don't know that I can get into this touchy-feely stuff. It's not touchy-feely stuff. It's being a human, right? It's having empathy. So some things that, we'll pause. We'll get Holly back up with the mic. Why? Why do you think we want you to share your personal and emotional stories? So you can recognize barriers. Yep. Absolutely.
Can you use the mic so people online can hear too?
Yes. Why else do we want to hear about your personal stuff and the touchy-feely emotional stuff?
Am I allowed to answer?
What?
Am I allowed to answer?
You're allowed to answer, Amanda. Yes.
Because I think that you're more than your CF. So we don't just want to know what's going on with CF because everything in your life impacts CF and how we can help give you the best care. So we want to know the whole story. I mean, not 3 hours worth of the whole story, but
Yeah.
share some.
You're more than just that yellow dot. And we want to know about it because it does impact things. Was there? Okay, I thought I saw another hand, or you were moving to another hand. Again, knowing the barriers to treatment. I'll share one story. An adult with CF, when I asked, why aren't you doing your treatments? What's getting in the way of you doing your treatments? He shared that his commute to work got longer. It can take up to 2 hours. He started taking classes again. The kids have been sick. There's just so much going on in his life right now. And I'm like, wow. You have a lot going on. I recognize that emotion. I showed some empathy, and then I want to work with him. Let's figure it out together, how we can fit these treatments in so you can remain healthy or get healthy again. Another example of emotion, one of our patients was transitioning from pediatric to adult. And we're all excited. It's a big deal. You're moving on to the adult world. And she was looking kind of sad, which is to be expected because she's been with us for the last, 19, 20 years. And I assumed this is pre-PEP skills that this happened. I assumed she was just really sad about leaving us and having to meet new people. Well, when I said, what's going on? Why do you look so sad? And she said, I'm not sad. I'm scared. Adults with CF get sick. And so I felt like we failed her. We didn't teach enough about adults with CF don't necessarily get sick. Adults can be healthy. I named the emotion that I thought she was experiencing, and I got it wrong. And that's okay, because that gave her an opportunity to tell me what she really was feeling, right? So it's important to have all of your chapters of your story be told within reason, right, Amanda? And then, we can partner together. So some ways that we may ask about the personal emotional story, or you may share, are via impact, your ideas, your expectations, and again, the emotional impact. So what that may sound like. There are a lot of things going on in my life right now that will make finding time for extra treatments a challenge. Can we talk about some of the risks and benefits of what you recommend to help me make an informed decision? Or ideas. The last time I was sick, the medication gave me some not so great side effects. Can we try something different this time? Again, you are the experts in your health, your child's health. You live it every single day. In many cases, you know better than us. You have better ideas than we do. Expectations. I've been starting to think about getting a job after college. I'd like to talk with someone today about how to discuss CF with potential employers. An emotional impact. Joey's been quite anxious about the blood work. Can we do that first before talking about anything else? Because sometimes there is something really heavy, right? That you need to get off and get done with, get over with, so that you can then focus on other things. All right, we're going to move into the third and final skill set, which is all about how we share information and then creating a plan together. So I'm going to read something. We'll stick with one of those examples about like going off to college. I have an almost 18-year-old who's getting ready to go. She doesn't have CF, so I have less to worry about than those of you who are sending your teenagers off to college. So here's as if I'm a social worker sharing information. There's a lot that goes into getting ready for college. The first thing you need to do is make sure you apply for all the CF scholarships. You can find information about those on cff.org. The next thing you'll need to do is meet with the Office for Students with Disabilities to see what they need from the center. It might be a form we have to complete, or it might be a letter. Once you do that, call me and let me know, and I'll make sure they get what they need from us. Also, you need to think about housing, and if you think you need a private room or would be able to share a room with a roommate. For this issue, you'll need to meet with the housing department at the university, and it's really important not to forget about your meal plan and discussing with the dietitian how to best get your calories from the options offered. Any questions? What do you remember what I just said? Anything? Meal plan? Dietitian? You caught a few words, phrases, right? So in my, and Becca, I'm not saying you would ever do this, right? You wouldn't download a lot of information like that, but we have a lot of information to share, and sometimes we get excited and we want to do it efficiently, and we may download a lot of information on you. We don't want to do that though. There are all the words that I said. That's a lot. But in PEP, we teach skills to avoid this download. And I love, this is my favorite slide. I had to share it with you guys too. If you want pineapple, and I say, here's a pineapple, eat it. Is that the best way for me to serve you pineapple? You're not going to be able to eat it, right? Unless you brought a really sharp knife with you and have a cutting board and all of that. No, I want to cut it up and I want to serve you bite-sized chunks in a bowl. And once you digest that, if you still need or want more pineapple, I'll give you another bowl of pineapple. Right? This is what we need to do with information. We need to chunk it up and share it in digestible bits. And for some topics or for some people, those chunks of pineapple may be too big. We may need to look at grapes and cutting them up like we do for toddlers. We may need to chunk out that information even tinier. So chunk and check, or ART loops, is the tool that we teach in PEP. And ART stands for ask. I ask an open-ended question. What do you know about the importance of huffing? And then I find out what you know. hopefully you know, because hopefully Holly and Lauren and I have done a good job of teaching you over the years why huffing is so important. If you know everything and you tell me, then I don't have to waste my time or your time explaining it again. Or maybe you know a little bit and not all of it. So then I need to give just that little bit extra chunk of information. So we want to avoid downloading big chunks of information. We want to use language you understand. We want to share it in these bite-sized chunks and check in frequently. So ask the open-ended question, listen for your response, and then I respond to you, yeah, you got that pretty right. You're pretty good at huffing. And then tell the additional chunks as needed. Holly, since you have the mic, would you mind just reading through, if we were to redo this conversation on getting ready for college, if you can just be the patient here? Sorry to put you on the spot.
Yes.
So if I were to reframe that conversation, it's so exciting that you got accepted into university. What plans have you made so far?
I know I want to live on campus, and I will need to make arrangement for it if I need to be hospitalized, but I haven't really done anything yet.
Okay, it sounds like you're off to a great start and that you realize there are a lot of steps to make sure you have a good experience. One of your most important resources on campus will be the Office for Students with Disabilities, and it will be important to schedule an appointment with them fairly soon. What, if anything, do you know about the Office for Students with Disabilities?
Well, I don't really know anything about it or that it existed.
Thanks for sharing that. That's why I'm here to help. The office has a lot of great resources. We're going to work with you on this and make sure you get the information you need. Let's look up their number now. So that conversation was actually a conversation, number one, but sounded a lot different than the big download I did, right? Hopefully you can appreciate that. So what can you say if you feel information was downloaded on you? Has this happened to you where you've been dumped on with a lot of information and you're like, what am I supposed to do? Where am I supposed to go next? What are my next steps? Thoughts on what you can say? There's a cheat sheet in front of you. There's a handout on this too. I'll put the prompts up there. I know we're running short on time here. Here's just an example of some things that you can say if you feel that you were given too much information and you're not processing it. And when it comes to wrapping up the clinic visit, making sure we're on the same page together. So there are just a variety of quotes there. You know, I'm not sure I got all of that. Can you go over that last part again? Or we made a lot of changes today. Can you make sure it's all in the summary I get in my chart? Before you leave, can I double check my list of questions to make sure we covered them all? So please make sure you are aware. Hopefully we're doing this as well and asking you the questions. What else do you need help with? What other questions do you have? And ensuring that there's understanding on the plan going forward, but we're humans. It may not happen all the time. And we really want to make sure that you leave the clinic or hang up the phone or whatever it is with an understanding that we are there for you to partner with you and that you're aware of your responsibilities and our responsibilities as well. So there's our just recap of the three main things that you can do to better partner with us, and know that on the other side of things, we're working on this as well. We're practicing these skills. So please tell us what matters to you. Ideally early on in the visit so we can prioritize and make sure we get the right care team members in there and answer all of your questions. Share your perspectives and emotions. Tell us all of your story. Tell us what's going on, you know, related to CF care and also you as a person. And then make sure we create and confirm a shared care plan together. These are two of the handouts that you have on your table that can help with moving forward into clinic visits for using these skills. And that's all. I have 1 minute that I can take questions or comments. I don't know. Those people online, Peter, right? I know I'm gonna try and scroll through and see what was shared here. One of our parents shared in the chat, as a parent of a daughter in college, I think it would be great for those parents or guardians who are okay sharing to start a list where our kids are. I hate that the issue exists about germ issues. So maybe that is a college age, Becca, a support group for college age or some kind of networking there. We have another person that shared, I personally like or prefer when the CF clinic professionals ask me questions. And we do. We're going to have our questions for sure. But we want to make sure that your questions are answered as well. And she added, many times I can't really think about what I want to talk about, but when questions are asked, I get more comfortable with sharing my thoughts and feelings. Yeah. What else? I'm going to wait for you to have the mic, Mark.
How long has PEP been implemented at the clinic, and do you see any positive results so far?
So our adult team went through the PEP workshop during the pilot phase of this program about 5 years ago. It was April of 2019 when we went through it. The pediatric team did it virtually in 2021. And then we did it again, peds and adult combined. For some people, it was their second time taking it. Other people on the team, it was their first time this past October. So we've had a few rounds of PEP training. I feel like I am a different clinician since learning these skills, but I would pose that question to some of our other people in the audience, and hopefully you guys have noticed, getting that paper agenda or getting the survey online. Or I would invite my colleagues on the care team to share what impact PEP has had for them. You guys didn't drink enough coffee. Sure.
Yeah, I was going to say, I know that I'm sometimes a download dumper, so I'm trying to work on that and be more aware to break things down smaller and catch myself. But I actually like the PEP skills too, just to get more engagement from the people that we're helping. Like, we can't help you if we don't know your story, like Karen was saying. So I think it's a positive, but we're still working on the skills.
Yeah. Dr. Pranjpe raised her hand.
Yeah, these are communication skills that we learn them early on in our training. We learn them in school. We always build on them. I take away something every time we talk about PEP. We talk about PEP a lot, and I'm taking some new stuff away today.
What are you taking away?
Give me a second and I'll get back to you. The other thing is I am allergic to pineapple, so I'm very sensitive to like the whole like dump analogy with that.
Thank you for sharing that part of your story, Shruti. I won't bring pineapple to clinic on a Friday morning now that I know you're allergic. All right. Thank you all so much. Hopefully you can find some of these skills useful. Try something out the next time you come to clinic or make a phone call, and remind us if we're not meeting your needs in terms of communication, let us know. Tell us, that was a big dump of information. Like, can you chunk that out, please? Please call us out. We're here for you. And, we want to be as supportive as we can. And I'm glad I saw that word come up there, that you think we are supportive. All right. Thank you.